Hey, I'm your host, Dr. Desiree Cassell. I'm an orthopedic and pelvic floor physical therapist specializing in women's health, aka pelvic floor. I'm a wife, mom of 3, foodie, lover of all things movement and nature, and I'm super passionate about educating, empowering, and supporting other women like you to find and maintain balance throughout all aspects of their lives, without pain, pressure, or peeing their pants. And this is the Balanced Momtality Podcast, where we will talk about all things pelvic floor, your core, and optimizing your pregnancy, birth, and postpartum recovery, providing you with the knowledge and tools so that you can feel like the strong, playful, and happy mom that you and your family deserve. Now let's get you out of those pads and back to loving movement. Fill up your water, pop in those AirPods, roll out your mat, and let's connect. Before we start today's episode, just a quick disclaimer that anything mentioned in this podcast is not meant to treat or diagnose any medical conditions. If you have any questions or concerns about your healthcare needs, please seek the care of your medical provider. This is also a safe space where we will be talking about very sensitive but important topics, such as issues with peeing and pooping, relationships, and even sex. So if you have littles around, probably a good idea to pop those AirPods in. But otherwise, I hope you enjoy today's episode. Hey friend, so glad to have you join me for another week on the Balanced Momtality Podcast. I hope you are enjoying your 2025 and it has been smooth sailing for you, because I know for many of us, it's been the longest January ever, and then we're already, now I feel like February was a blink of an eye, so I don't even know where the year is going. I feel like it's already going to be March, which, to be honest, I am so ready for. I am ready for spring. I can't wait for the warmer weather. Here in New Mexico, we have had what we like to call fake spring. Seems like we have winter last a lot longer here, and spring likes to peek its head here and there and tease us, or it's nice outside, but the wind is miserable. And so spring in New Mexico is also kind of iffy. Sometimes it snows, sometimes it's 70, but we've got 30-mile gusts of winds. And so it's going to be a little trying as we start trying to get outside and move more. I am anxious for it. And so again, this week, I just wanted to hop on here and just dig in a little bit deeper to breath work. So last week's episode, which I hope you got a chance to listen to, this will build on that a little bit. But if you didn't, no worries. You'll be totally fine to listen to this. And then I would just go back and listen to it, because last week I did give a lesson on what I do in my vaginal internal pelvic floor assessments, why they're so helpful, why we should know that information, and also how you can do your own self-assessment to get a better idea. Maybe you don't have the accessibility or the opportunity to see a pelvic floor PT in person, and we are also all different. We are not created equal. Some pelvic PTs don't do internal work. I am a big fan and a huge advocate for doing the internal work if you are or claim to be a pelvic health therapist, just because that is the huge link that we tend to miss, right? This is what I feel like sets me apart from just an orthopedic therapist, because yes, the pelvic floor is a muscle and the pelvic girdle are bones. And so it's not much different from other orthopedic issues, meaning there is a lot we can do with just external work and not doing internal. However, being that it is still an internal space we can't really see, and that it's connected and functions a little differently than all the other muscles in our body, and the fact that our internal space is something that we can't really feel, but it is still so connected into our nervous system, especially with all of the autonomic connections from the pelvic organs. And just the nervous system connection alone here is a little bit different than the rest of the body. And so having that internal awareness is huge, even when I'm not treating a patient internally. Maybe they're not appropriate for that internal assessment, or maybe they just don't want it, which is fine. There's still a lot we can do. But with that awareness of what is going on internally or what could be going on internally, it really changes how I approach things even externally. So I am a huge advocate for that internal assessment. And the last episode does give you some insight on what that internal assessment looks like, as well as how you can do a little self-assessment yourself. I do note that that internal assessment does not replace a thorough, comprehensive assessment from a pelvic floor PT. But again, it is way better than nothing if you don't have that access. And even if you do, it's great just to know how to do this to yourself so you can keep an eye on things, maybe in between sessions with your PT or as you phase out of more consistent care. You can have this tool to be able to check and see and have that insight of, oh, this is getting a little tighter than it's been, or, oh, this is feeling stronger than it was, right? That way we can be proactive. And that's really what I'm about, is being proactive and preventing issues. But especially if you have those symptoms or any pain, leaking, pressure, or you're just not sure if things are coordinating well, we do want to make sure that pelvic floor is being looked at, because externally it might look like you're bracing well, your abdomen might look great, your spine might not move, and everything from the outside looks good. But then internally we feel and find out that the pelvic floor is just spasmed up and not moving at all. Or maybe with how you're breathing and bracing into that, it's not going into the abs, so we're not seeing pressure into the belly, but maybe it's all going to your pelvic floor and you're increasing risk of prolapse. So again, that internal assessment can be such a game changer and bring a lot of awareness for what the true status is of your pelvic floor. So I do think you should go listen to last week's episode if you didn't already, just to get a better idea of what that looks like and what you can start doing to assess your own pelvic floor. Because today I want to kind of build off of that. And so we're diving in, going deeper into breath work. This is beyond the basics of breath work. So a little bit of troubleshooting in this, and also a little bit of, after you do that vaginal assessment, how does that change things, right? Like based on what you find, what might that then say for you that you need to focus on? And so one, say you don't have any pain, right? Like you're like, I don't have any pelvic pain. I don't have tailbone pain. I don't have hip pain. I don't have back pain. I don't have pain with sex. So you're like, pain is a check. I have no pain. That's fine. But maybe you take your thumb and you place it in that vaginal opening and you give a little pressure down on your perineum and you kind of stretch a little bit, and it's all of a sudden really tender or sensitive and you're surprised, because this is common, right? I get a lot of women without pain and they might think, oh, I'm just weak. Everything's weak. I just need to Kegel things. And I'm like, okay, well, let's truly see that. Let's see what your pelvic floor is actually doing. And yes, it might be weak, but most of the time it's weak because it's locked up. Remember, we've talked about this in other episodes about Kegels and pelvic floor contractions, how you should feel that level change, right? You should feel that contraction come from that level 1 resting tone all the way up to level 2, 3, 4, 5. And as you're working with your breath work and with your bracing, you should feel those level changes. With the breath work, you should feel that breath come into the pelvic bowl and stretch it from that level 1 into what we call the basement and really open things up and feel that perineum expansion. And then with the bracing, on that exhale, when you're contracting and tightening your brace, you should feel it again lift up through those 5 levels as well, depending on the intensity, right? Like we're not always going up to 5. Usually that level 5 is that sneeze, the cough, the quick, short moment. A lot of the in-betweens with the bracing, we're lifting up to level 2, 3, 4. Just depends on the intensity there. But if you lift up, say you go from 1 and you lift up to 3 or 4, when you relax and take that breath after doing that exercise, you should then feel it go from 3 or 4 and drop back down to 1. So we need to have that assessment and just some awareness of what does it feel like to contract? What does it feel like to relax? And then what does it feel like in between? Can you feel those level changes on the breath and on the bracing? Because say you come in with the thumb and you're stretching around the perineum and it feels a little tender. That for me is a sign that yes, things are tight, because especially at the perineum, that's where all the layers are connecting with the pelvic floor. So the deep fascial layers, the super and intermediate fascial layers, they're all binding there at the perineum. So maybe you don't have pain with sex, but then you go push on the perineum and kind of swoop your thumb through that bottom half crescent of the vagina, and you notice lines of tenderness. That is a sign that those muscles are probably tight, and they're probably what's engaging when you're tightening and engaging your core. Whereas we want to open those tight spaces up so that the whole bowl, especially the muscles that aren't tight and banded, are lifting and engaging when they should. So when it comes to the breath work, yes, the first step is just feel it in the pelvic floor. Can we get it down there? The next step is, can we get it there first? Can we get it there before the belly rises? Can we get it there, especially before the chest rises, but even before the back and sides, so that it can have a little bit of time to breathe and lengthen and stretch those tight muscles? Maybe for you, you feel lots of pelvic floor expansion and you feel no back expansion. Then that is what I want you to focus on, is feeling more expansion into the back and having that be the first space that you breathe into. Wherever your tightest spot is, that's where you want to aim the breath first. Most people have never felt it in their pelvic floor before, so as we start this breath work, that's usually their tight space initially until we get things coordinating and working together. But say you do feel that and you're like, done, yes, I'm feeling it in my pelvic floor, I'm feeling a little expansion in my perineum, cool. There's more to it than that. So now we get more specific. Can we break up that pelvic floor in halves? Can we think about it as the front and the back? Are you feeling equal expansion around the vagina and the rectum? Or do you maybe feel that breath come in all into the front and stretch out the vulva and the vagina, and then maybe it hits the tailbone in the back and the rectum at the very end? Or maybe you don't feel expansion there at all. That would again be a sign that that's where your internal tightness is. Or maybe when you're doing that release work, you're feeling tightness more on the right than on the left. And then also thinking about that pelvic floor in halves of right and left. With that pressure and feeling tenderness, bring that breath into that side. If you feel more tenderness on the right than the left, then you are going to try and prioritize that breath going into your right butt cheek and trying to breathe more into the right side of your pelvic floor than the left. Yes, you will still get most of it, and you're not just going to turn one half off and only get expansion on the other half, but we can encourage and bias breath to go into certain spaces. And that's where it's so helpful to just know some basic mobility positions and yoga poses and stretches so that you can say, hey, well, my tailbone isn't expanding very much. What are some positions I could put myself in to do some breath work to help open up my tailbone a little bit more and get more expansion into the back of my pelvic floor? Because every time I do my breath, I feel it more around my vagina. That is the goal, is really using our breath and being intentional and aware every single time you do it, because it can and will change on you. You might go through the motions and think, deep breath, going into my pelvic bowl, great. But if you're not listening closely enough, you might miss the fact that your breath didn't really stretch into your left butt cheek. Maybe it didn't really go into the rectum very much. So start thinking about that pelvic bowl in quadrants. So you can definitely break it up into halves and think of right and left, front and back. But then if we lay that on top of each other, it does break it up into a grid, right? So we've got front right corner, front left corner, back left corner, back right corner, etc. So we can think about those quadrants so that if you're not feeling expansion there, especially if you used to, that is a sign that space is tightening. But we can also bring this breath awareness up higher, right? So maybe you're in child's pose doing some back breathing and you notice more on one side than the other, right? Like you notice more side expansion on one side than the other. Then reach over with child's pose and just create a reach to open and stretch the side that isn't really expanding so we can force the breath into that side and get it to expand. We really want to have that specificity of not just is my back expanding, but is it expanding equally? Do I feel both sides of my back expand? Do I feel both sides of my sides expand? Do I feel my rib cage expand equally side to side and front and back? So we can again just get more specific with that breath work and really trying to be in tune, put it into those tight spaces, and just use what you find with that vaginal assessment to help guide you. Now, if you're on the other side of that and you do that vaginal assessment and you're like, I'm clear for any signs of tightness or tenderness, nothing really hurts very much, and I don't have any pain elsewhere, and I don't know if I'm contracting well, and it seems like I'm kind of weak because I can tighten a little, but I'm not feeling as much of a lift. This is where for you, we want to go deeper into how you're bracing. How are you contracting and engaging your core? Whereas the other one with pain or tenderness, we're getting really specific on how are we breathing? Where is that breath going? But then even with those people, we start to look at this other bucket as well, because maybe those muscles are tight because they, again, are the only ones turning on. And so if you're someone that as you go to brace, start again, you should feel that bottom up lift, right? You should feel it start with a gentle Kegel, and then your core should kind of zipper up from the bottom up. So we should be feeling and be aware already of that pelvic floor lift as we exhale. But how does it feel? Is that pelvic floor lift all coming vaginally? Are you feeling only the vagina kind of lift up and in and your rectum does nothing at all? Or are you maybe feeling your rectum and anus kind of puckering up and in and your vagina and vulva are just staying extended from your inhale? That is where we can again get specific of, are they both coming? Because they should. You should see an equal expansion of them on the inhale and an equal contraction up and in of them on the exhale when you're bracing. And if you go to brace now and you're feeling it all rectally and you're like, oh yeah, I'm not really feeling it much around the vulva or urethra, then that's what I want you to focus on is when you're going to brace, start that exhale Kegel from the front. Try and think of those vulvar lips closing around a finger, or think about, these are weird cues because they are food cues, but I don't know, studies show that they work. So think about picking up a blueberry with your vagina or sucking a thick smoothie through a straw with your vagina. These tend to get more of the front part of the pelvic floor to turn on, which again, after vaginal birth, this is a very common pattern. The front is very turned off, whereas the back is super, super tight. So for these people, they tend to not feel much expansion with the breath in their tailbone, and they feel it mostly vaginally. And then when they go to engage and tighten, they feel mostly the rectum come up and in and not much of the vagina. And so that's where it's kind of that balance of, okay, well, we're going to prioritize the breath work and the lengthening into the tailbone and back side. And then when we're bracing, we're going to prioritize feeling that lift from the front. Again, we're not going to fully cut it off. It's not going to be only the front and only the back when we do this, but we can create an intention that does change how those muscles engage together and how much one side might tighten or let go than the other, depending on the positions, depending on how we're tensing and holding things. So just start bringing some awareness both into that breathing into the quadrants of the pelvic floor, feeling equal back, equal sides, equal rib expansion. But then on the engagement, start to check in. Are you feeling both the rectum and vagina come up and in, or are you only feeling the front or only feeling the back? And then same thing with up in the abdominals of the core. When you brace, we need to make sure that it's not all upper abs, right? We need to make sure that those upper abs aren't taking over the bracing, because that's like putting a rubber band around the system and shoving everything down. So if we can feel that coordination come from the lower, middle, then upper abs, that's going to support everything from below and stabilize with the spine, versus just holding it and locking it in. Those lower abs might still be kind of turned off from pregnancy, even if it was 10, 20 years ago, and those upper abs have been gripping the whole rest of your life to try and keep everything stable. It's no wonder every time you engage, you feel your upper hand or your upper abs engage first. So it just takes retraining. And to me, that also says that's a tight spot. If it's a muscle that's always turning on, you might want to do some breath work into those upper abs. You might want to start massaging those upper abs, especially if you physically see a line across your upper abs. Many times this is just because you've been gripping those upper abs for years, and now your fascia has created a tight little line right there. And this will keep them turning on. So we want to stretch it out, skin rolling over this space. Again, it's about balance. So we're breathing and massaging and mobilizing tight tissues while engaging and contracting and bracing more of those weak and truly stretched out tissues. But we do need to be able to identify, are they truly weak and stretched out, or are they weak because they're locked up and cramped up? Because if that's the case, we do still have to prioritize breath work before we really prioritize strengthening and engaging. So if that self-assessment left you a little more confused and you're like, okay, now I really don't know what I should be doing, one, sorry. But two, that's okay, because this is a lot of information that many women have never assessed or even thought of before. And so that's where you reach out. Let's get you on a one-on-one coaching session and help you break down what you found with that assessment. Make sure you're doing that assessment correctly. Make sure you're choosing what to do after that assessment correctly, because this is where we can get in trouble. If we think things are weak and we just start strengthening, we can cause lots more pain. So we do need to make sure we have an idea of what's going on into that internal bowl, but also how is that breath? How is that brace? And it is more in depth than just breathing and just engaging. So I'm here to help you troubleshoot it. You can also hop in on my 8-week online restore program, where I do walk you through a lot of these concepts. And then you do have that individual approach option where you can show up to the group coaching calls and get feedback, or reach out to me inside the private community inside that program, where I can give you that individual feedback and help you troubleshoot some of these concepts as you work through the weekly lessons and weekly exercises. But otherwise, go over to the Balanced Momtality Wellness and Support Group. That is a free and private group there. Feel free to also ask questions there and just show up there for more pelvic health and balancing all the things, tips and strategies. But always fun chatting with you here. And please, if you haven't, leave me a 5-star review here on my iTunes page at the bottom of my podcast show. This really does show me that what I'm doing is reaching you and impacting you and inspiring you, and helps it so that other women can see this information and know that they are not struggling alone. And it just does also help inspire me to keep showing up here for you. So I can't wait to see you here next week on the Balanced Momtality podcast. But until then, go practice some breath work. Well, that's it for today's episode. I hope you enjoyed it as much as I did, and I want to thank you so much for taking the time out of your busy day. I know you've got so many other important things going on, but I hope it was helpful and you leave here with some tools to help you in your healing journey. And I just want to ask you, if you have found this helpful, to please leave a review on iTunes. Scroll down to the bottom of my podcast page and leave that 5-star review so it can help other women see this information. And also, if you want to be a part of my community of amazing women trying to balance all the things, great tips and insight, and sharing stories and just motivating each other along the way, feel free to join my Facebook group, The Balanced Momtality Wellness and Support. I hope to see you here next time on the Balanced Momtality Podcast.